All right, I am thrilled to introduce our community today to Dr. Marcia Harris, pioneer in hormone optimization in women's health with over 40 years of transforming lives. After completing her medical degree at Columbia University and training at Weill Cornell Medical Center, she discovered a critical gap in women's healthcare, particularly around menopause and hormone health. Dr. Harris introduced bioidentical hormone therapy to New York over 3 decades ago, long before it became mainstream. And through her practice today, the Wellness Restoration Center, she's developed the groundbreaking total transformation program that has helped thousands of patients reclaim their vitality. She's firm against the one size fits all approach and dominates women's healthcare today, which makes us love you already. Welcome, Dr. Harris.
Thank you so much. Thank you so much for having me, Lindsay.
Thrilled to have this time together. We've kind of had this on the calendar for a while, and I got so excited when I was like, today's the day we get to pick your brain. And I was wondering if you wanted to start with, because I think this is really important. You talk a lot about root cause medicine, and you're very much with women in my community, that kind of like that midlife seasoned women piece of life where perimenopause is coming in and menopause. So why do you have such a strong focus on uncovering like the root cause of illness, and when did that play into your medical experience?
Well, you know, before I even go into that, let me just congratulate you for what you're doing because this women's health is always on the back burner for whatever reason. We're treated like second-class citizens, which makes absolutely no sense because, I mean, we are the ones who take care of everybody. So what you do is just so important. I want to congratulate you and praise you and emulate you and make sure all your listeners know and appreciate what you actually do.
Thank you so much. Thank you.
Yeah, I am, as you said, allopathically trained and practiced for 35 years what I was taught to practice, which is wait for something to break and then try to fix it.
Mhm.
About 29 years ago, I was presenting at a conference in Atlanta, and I didn't feel well before I went for about 4 or 5 or 6 months, not just overnight, but for a while. I had gained 50 pounds. I was sluggish. I was not myself. I knew something was going on. And I kept saying, you need to check your thyroid. You need to check your thyroid. But I just never did. I was also perimenopausal at that time. And I woke up one morning with a Mack truck sitting on my head, literally 10 tons of steel. I couldn't get out of the bed. And finally, after I'm not sure how long, it might have been 3 minutes, it might have been 10. I'm not sure, but I was able to drag myself to the bathroom where I peed and I stooled, and then I started puking. I started vomiting. When I started vomiting, the doctor kicked in and I said, okay, you're blowing your brain. If you do this right, you'll live to tell about it. If you don't, they're going to be going to a funeral. So here I am in my late 40s, having known that something's wrong, but not doing anything about it. I was so busy taking care of everybody else that I ignored it. I picked up the phone, thank God, in hotels, in big hotels, there were phones in the bathrooms, and I picked up the phone. This is Dr. Harrison, room 1211. I need help. I don't know how long it was, but security came up first. I was at the time in and out of consciousness.
My goodness.
My blood pressure, when the paramedics took it, was 255 over 144. I assume everybody knows what that means. I don't remember the trip to the hospital. I don't remember most of the first 36 hours because again, in the emergency room and then in the intensive care unit, I was in and out of consciousness. 10 days later, I walked out of the hospital, took a plane back to New York, and that was my wake-up call. At that point in time, I said, it doesn't make any sense for us to wait for something to break and then to fix it. There's got to be a way to make it not break. So that was my epiphany, my wake-up call. I came back to New York and I changed the way I practiced. First of all, I changed the way I lived. I kicked out the husband. He was the major cause of my stress. I packed his stuff, checked him into a hotel. Okay. I started exercising because I was a jogger initially, but at that point I was so busy doing 12, 13, 14 deliveries a month by myself, operating all day every Friday, 2, 3, 4 major cases, all of the above. And I was just not taking care of me. At that point, I said, you got to start taking care of you. And that's what happened. Kicked out the husband, started exercising. Matter of fact, in the next 6 months, I lost 60 pounds, stopped eating meat, went to a plant-based diet. I literally started doing all the things I knew I should have been doing, but wasn't doing.
For our listeners' purposes, because they'll smile, because I always say, my clients say, I know what to do, I just need to do it. And then there's this old Chinese proverb that says to know and not do is to not know. Like there's some part of us that there's a reason why we're not doing what we're doing or need to be doing. And sadly, it does sometimes take that wake-up call. And then you rippled into it. I was going to ask you, when you did one good thing for yourself and it probably gave you enough energy or more feel good to get the next thing flowing, like was it a process for you to keep, or you just did it all at
No,
once?
it was
No.
not a process. I
Okay.
was a surgeon. I am a surgeon. It's all or nothing. It's do it or don't. There's black or white. I have no gray. I have no gray. Something's wrong. You chop it out and you say next.
I love your answer. So raw and real.
I'm just telling that's just who I have been and who I am. You know,
Yes.
now with patients, I do give them a chance to slide into it, pick one thing and then pick a second and pick a third. But no, I just went, that's it, and changed everything.
Everything. And do you feel like, because we're going to dive into hormone health and do you always feel like this piece was part of your whole body process with patients as you're switching over? Did that come a little later?
Oh, there is absolutely no question that it's a part of it. I mean,
Mhm.
if you think about it, there are 1, 2, 3, there are 4 major areas. And I have a little mini course about this. There are 4 major areas. 1 is nutrition, 2 is hormones, 3 is inflammation, and 4 is stress. And just about everything else come under those 4 headings. And I know I addressed it all at the same time. And that's when I started on hormones. Because as I said, I was also perimenopausal and I was almost non-functional at that point. As a matter of fact, the nurses would see me get off the elevator and duck into rooms at the hospital because they had to peek out and look at my shoes. Is she wearing heels? If she's wearing heels, we're okay today. If she's in sneakers, we're staying in this room because she's going to start screaming. You know? Oh no, I hormones were addressed right then and there. As a matter of fact, I tell everyone, and I tell all the patients, I found bioidentical hormones for me because I was completely non-functional,
Mhm.
completely
Ah,
non-functional.
So this is so amazing, and I'm sure you get bored talking about this a little bit because I do think we have to like rewind and start here. Our community's not newbies with all of this, but do go into, I'm sure at this point in your career, this feels so like innate and natural. And of course, hormones are part of it. And of course, this is in conversations. Why can we still walk into a doctor's office and not have hormones addressed?
It is so sad. Back in this, I mean, I've been in this since the late 60s. I got out of medical school in the early 70s. Oh,
Mm.
that's right. I take the glasses off when I say that. I love telling people my age. Okay. I I got into medicine in the early 70s. As a matter of fact, I filled so many bills as a Black woman. I was the first Black female to train in OBGYN at the New York hospital, Weill Cornell Medical Center. When I showed up there in 1971, they didn't have a clue what to do with me. I would
Wow.
walk into the room and say, "Hi, I'm Dr. Harris. I'm here to admit you to the hospital." And they would say, look me up and down and say, "Can I have the bedpan?" And I would get the bedpan, I would take it away, wash it, bring it back, and say, "Now can I admit you?" And they'd look me up and down again and say, "Can I get some towels?" And I would go get the towels and come, because again, the only reason I could possibly be there is if I was the aide.
Oh my
So
gosh.
after doing everything they needed done, and I was still there, they'd look me up and down as if to say, "Why are you still here?" And again, I would point to my lapel and say, "I'm Dr. Harris. I'm going to admit you to the house." "You're the doctor?"
Oh
"Yeah,
my gosh.
I'm the doctor." All right. There were guys on staff during my residency, because at that point, even OBGYN was an old boys club. Like now,
Interesting.
half the gynecologists are women. In those days, they were all men. It was an old boys club. I was the first Black female. I was the eighth woman. Now, New York Hospital is the second oldest hospital in the country. In 1971, I was only the eighth woman to ever go through that program.
Oh my goodness. Wow. Wow. I'm
Okay.
so honored. I'm so honored to be sitting across from you right now. This is amazing.
So we were taught, my generation of doctors
Mm.
were taught about hormones. As a matter of fact, in the 80s and 90s, we used to put everybody on hormones.
Mm.
Then you know what happened at the end of the 90s. And it was with good intention. The woman who was in charge of the CDC at the time decided that there really had not been any prospective studies, any real studies which proved what we thought we knew, which
Mm.
was that hormones were protective.
Mhm.
They protected our hearts, they protected our bones, they protected our brains, they were good for our skin. I mean, there are 400 different functions that our hormones perform. Of course, not just the sex hormones, but also insulin, cortisol, all the other hormones, thyroid, which is the functioning unit of the body. I mean, that controls our entire system. And we didn't know, because there had been no studies going forward. We thought they were protective, but the woman in charge of the CDC, and I don't remember her name right this second, but she decided that we needed to have as large a study as possible, multi-hospital, multidisciplinary, and we were going to do it. We were going to prove once and for all that all of this stuff was good. So it was with good intention. However, the study was so flawed. I mean, totally and completely flawed. You are going to do a study to prove what she intended to prove, that this is indeed protective. But the average age of women in the study was 64 or 65. Now, how are you going to not put in the 40-year-olds because they're symptomatic if you're going to get an answer? So there was that whole 15 years from 40, which is when perimenopause starts, to 51, 52, which is the average age of menopause, and wait to the mid 60s. It was totally flawed, totally skewed. In addition to that, as I'm sure you know, it was horse's urine that was being used. The type of estrogen and the type of progesterone, well, the progesterone was a progestin. It was mixed in a test tube. And between the conjugated equine estrogen, Premarin, pregnant mare's urine, and the progestin, there was no hope. Number three, at 65, if you've gone through menopause and you've been perimenopause or you've been losing your hormones since about 40, which is when perimenopause usually starts, you now, all the protection that the hormones have afforded you to that point have started going away. And it's like a slide. Some people it's 2 years, some people it's 10, but eventually you're going to fall off the cliff and you're going to crash and burn. So when you put it all together, the study was doomed to begin with.
Yeah.
Now, in addition to being doomed, it was also misinterpreted. So you got it going and coming.
Mhm.
What happened after that, and I tell you something, I remember that day that the New York Times and the Wall Street, I remember the headlines, and I remember that day because if my phone didn't ring 200 times, it didn't ring once.
Oh, I can't even.
Everybody. Because
Yes.
what women did was they basically just stopped
Stopped.
all their hormones, which doesn't make any sense now, didn't make any sense then, but all they saw was the headline.
Yeah. Panic.
The
Mhm.
headline was, of course, fallacious, but that's what they saw. And in reanalyzing the study, by about 2 years later, by 2004, when they analyzed the data all over, there was only one arm of the study that gave any concern. Everything else really did prove what we said. But by that time, it was not headline Wall Street Journal. It was not headline New York Times. It was on page 50 in a two-column, lost
Yeah.
in the mire. So not only that, the medical schools at that point stopped teaching about menopause. So there's a whole generation of doctors out there who know absolutely nothing about menopause. And there's still patients coming into me daily, weekly, monthly, who are saying, oh, my doctor says, my gynecologist says, I'm not to do that because it's dangerous. Hello. Now, anybody out there now who does their due diligence will know that that's not true.
Yeah.
It isn't. But we're hard to come by. And a lot of doctors are like carpenter ants. They follow the leader. So one of the soca Trinidadian carnival songs, follow the leader, 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 follow the leader. They're like carpenter ants. And
Yep.
they're gonna fall off the cliff, but they just follow the leader and don't do the due diligence and research for themselves.
And do you feel like that is, I mean, I know everyone is crazy busy back to wearing a thousand hats, especially women who are now more prominent in the profession. Do you feel like if we're giving a lot of grace and leeway, there's just, it's a time thing. Like they weren't taught it in medical school, and now to learn it or relearn it, no.
I did. I went out there and found the information for me. I had to because I wouldn't be sitting here now because
Hmm.
when I say I was non-functional, I was non-functional.
Hmm.
So I was
Yes.
forced to find an answer. I was forced to find it for me.
Right. Which you're a great example too of, I feel like the women that I know who have really gone the hormone pathway at the moment have also had the symptoms that really pushed them. It wasn't just a let's be preventative, where I think we're trying to get to that point of, and I'll like your opinion on this, but probably everybody in our perimenopausal phase should be considering or looking into hormone replacement, but it's not. It's the desperate individuals at the moment that I see seeking the help, willing to pay for the help. What's your
And
thoughts around all of
and
that?
that is actually that is true, but it's also unfortunate
Yeah.
because the protection is real. The protection is real. Estrogen maintains our bones. Testosterone actually rebuilds bone. I have women come in, the orthopods and the cardiologists are now sending me patients because, for example, the bisphosphonates, the medication that's used to treat osteoporosis and osteopenia, is
Mm-hmm.
horrible, horrible medicine. I mean, it's so bad. You can barely tolerate it. And whenever they get somebody, you have to take it on an empty stomach. You have to be upright for half an hour. I mean, there's a whole slew of instructions. It's horrible medicine. When they can't control somebody with medication, they're now sending the patients to me because it actually rebuilds. Testosterone actually rebuilds normal trabecular bone. I can do a whole study. I have hundreds of women who have gone from osteopenia and osteoporosis back to normal trabecular bone. It's taken 2 years or 3 years. It doesn't happen overnight, but it happens if you replace the hormones. So, as I said from the beginning, why wait for something to break and then try to fix it? Why not just maintain it? So, as soon as you go into perimenopause, you really should check out getting treated, getting
Right.
the hormones actually replaced.
And we're not saying just a few women, like, let's just continue to be clear.
We're
This is
saying, I'm saying
everyone,
everybody.
everyone.
I am
Mhm.
saying everybody. Now, don't get me wrong. There are certain circumstances where maybe I wouldn't put you on hormone, but that
Sure.
is few and far between.
Mhm.
There, even with metastatic breast cancer, that was one of the problems with the study. Oh, it increases breast cancer. We now know that's not true. It actually is protective against breast cancer. In one arm of the study, it went from 4 women in 1,000 to 5 women in 1,000.
Mhm.
From 4 to 5 in 1,000. That's
Right.
0.08 or something like that.
Yeah.
But again, it went from 4 to 5 and everything blew up.
Well, it's interesting because I was talking to a girlfriend about and just hormones, blah blah, and she wrote back like, "Oh, I could never be part of that because my sister has like they somebody did the genetic test and their family's prone for a genetic marker." What are your thoughts around that? If somebody instantly said that to you, what would be your response back to them?
My response would be it depends because there is so much writing on it in terms of protection. Dr. Rebecca Glazer, she's at
Mhm.
the Cleveland Clinic. She's done a
Mhm.
lot of
I've heard
the
of her.
a lot of the articles out there on bioidentical hormones. Now, she and I trained in bioidentical hormones at the same time by the same person in Arizona 29 years ago. At the time, she was actually a breast surgeon up at the Brigham in Boston. And in 3 or 4 years after we trained, she transitioned from that and went to Ohio, you know.
Yes.
Rebecca, right now, waits about a year, even with HER2 positive breast cancer. Rebecca waits a year and puts women right back on it.
Mm. Right. And then I'm going to bring out another let's blow everybody's minds and make sure we're on the same page. But like my 73-year-old mom, who has been introduced to all of this wonderful chat because of podcast land and getting these amazing physicians on here, has restarted on hormones for bone health and brain protection. Would you agree with that?
Absolutely. I put a 72-year-old on them last week.
Okay.
Now, let me clear something up. It is protective. So between when that person went through menopause and now at 72, we have almost 20 years.
Mhm.
The NAMS, the Menopause Society, says 10 years and you've missed the window. Not true. What you have to do is make sure that you are not going to do the person harm. So I get calcium scores, I get inflammation levels, I figure out if there's anything there that I'm going to like knock off a plaque or something like that before I started. This woman was whistle clean.
Yeah.
She'll be fine.
And again, let's just reiterate, like I feel like on this side, the bone piece that you can rebuild bone.
What
Amazing.
kills little old ladies? Hip fractures.
Yes.
It's almost 50% in a year are dead after a hip fracture. Men and women. It's actually a little lower in women than men. Men, it's definitely 50%. The women, it's about 40%. Within a year of a fracture are going to be gone. Hello.
Right. So, and keep going with the medicines because, yes, they're terrible to take that the doctors are prescribing, but also, can you give the scientific what's happening to the bone when people do the prescriptions for trying to rebuild bone
Well,
and
no,
why?
there is no prescription out there that actually rebuilds bone. What the bisphosphonates do is they keep the bone where it is. So at whatever level it is, it makes it not get worse. It does not improve it, does not make it get better. It does make it not get worse, but it does not improve it.
I have also heard that because it's not shedding old bone, that it can become even more brittle. Like it looks good on a DEXA scan, like your numbers will improve,
That is
but the
correct.
brittleness increases.
That is correct.
Okay. Just trying to learn as we go here. Yeah, so interesting. So even as we're wrapping up this little piece of this, no woman should take themselves off the plate of asking or investigating. You have not aged out of the opportunity to improve or protect.
You haven't.
Should we talk about brain health for a minute? Because I know a lot of people I talk to when we talk about their why and why they care about getting healthy, they have family history of Alzheimer's and dementia, and brain health is a huge piece of wanting to get healthy. Where do you go in that conversation?
Well, it's exactly the same thing. It is brain protective.
Mhm.
And it's outside of the ATT CR, outside of the amyloid problem, it protects vessels. So the same way it protects the vessels of the heart and the vessels of the kidney and the vessels in your legs and so on, it protects the vessels of the brain.
Yes, all this beautiful protection. And we cannot leave this. I can't believe we haven't talked about it, but the bioidentical part, you said you basically founded bioidentical hormones. So for the individual who doesn't understand these terms or like synthetic versus or is nervous about going on hormones, let's put some people's minds at peace here.
Okay. The horse's urine, the pregnant mare's urine, if I'm going to use my hands, the molecule is close enough that it helps, but it was not the same. What happens with bioidentical, bio means life, identical, same as, the molecule that is extracted from edamame and Mexican wild yam and soy and sweet potatoes and what have you is exactly the same. It's diasgenin. It is exactly the same molecule. So the key actually fits the lock.
Hmm.
So the body doesn't know the difference between the plant stuff that is used to compound these medications and what the body actually makes. That's the difference. That's the difference. The plant stuff compounded from the diasgenin is the exact molecule that the human body makes. So the body thinks that it just got your ovaries back, you know.
Mm-hmm. So this happens all the time that a client will be like, oh, yeah, yeah, I'm on hormone replacement. For that person to fully understand if they're on appropriate bioidentical versus synthetic, like what are some of the questions they should be asking their physician, or what's the research they should be doing on their own to feel very confident? Because this is so confusing. I mean, it's confusing to the medical population, let alone your average person who's just trying to get on board.
It is, and it can be confusing. But basically, what you have to do, what women have to do, is find a practitioner who will work with them, number one, and who will be upfront in terms of telling them what it is, etc. A lot of people are not giving and not using the horse's urine stuff, which, by the way, is still out there. It
Mm-hmm.
is still out there. I still see patients who come in saying, I'm taking my Premarin, I'm taking my medroxyprogesterone. And I shake my head, but, I try to ease into it. Okay?
Yes,
Try
it's
to
not their
ease,
fault.
try
They
to
don't know.
ease into it because first of all, it's a good thing that whoever they're working with actually acquiesced and gave them the hormone to begin with. Because what normally happens is women are dismissed. Oh, you're just getting old. Oh, you just tough it out, grin and bear it. Oh, it'll go away eventually. Oh, yeah, you're symptomatic now, but it'll go away. And they're dismissed, which obviously is a problem. Obviously. So it's the fact that the practitioner has actually acquiesced and given them hormones to begin with is a start.
Yeah.
It is a start. But what the women have to understand and the questions they have to ask is, why are you giving me this when supposedly there is something better? And if that person insists on there's no difference, it makes no difference, etc., then they need to look until they find someone. I had a 45-year-old, 44 actually, when she came in about a year ago, referred by a friend, and she had been suffering for about 2 years. So she started getting menopausal symptoms, perimenopausal symptoms, when she was 42,
Mhm.
her 42nd, her 43rd year. And she had been to 5 different gynecologists. Not one, not two, not three, not four, 5. And they all dismissed her. They all dismissed her. At that point, she waited 5 months, almost 6 months, to get an appointment with the head doctor of the menopause clinic at one of our premier New York institutions. I obviously will not say which one, but she waited 6 months almost to get an appointment with that person. She went in, and that person looked at her and said, well, your periods are regular. Yeah, you're having some symptoms, but here's a prescription for gabapentin. Here's a prescription for an SSRI, and here's a prescription for Veoza. Let me see you next year. Talk about mind blown. My mind was blown. The head of the menopause clinic, who was giving her treatment for her symptoms, not for what was causing the problem, which is she didn't have a Prozac deficiency. She didn't have a gabapentin deficiency. She didn't have a Veoza deficiency. She had a hormone deficiency.
Well,
She
and I
came
really want
back,
to break that down one more step for our people who are like, I don't know what those are. That I'm guessing she got given gabapentin for sleep, like she probably wasn't sleeping well. And then
yeah,
she was given the
and her
SSRI for,
nerves, sleep and
okay.
her nerves, and to calm her down. And the Prozac is an antidepressant because she was anxious, she was depressed, she was anxious, she was depressed. And the Veoza is for the vasomotor symptoms, the flashes and the sweats so she
Yeah.
literally treated each set of symptoms as opposed to treating the cause, which is your hormones are declining. They need to be replaced.
Oh,
She
thank
came
you for
back,
that story.
she came back in less than 2 months. And I mean, the blessings I get are amazing.
I can only imagine.
Okay. The
Yeah.
blessings I get. I've had husbands call me and thank me for giving them their wives back.
Yes. Yes. Marriage is saved, right? Because,
Absolutely.
yes. Oh, no, thank you for that story. And it is about, again, treating symptoms, the whole person. And I know we could do a whole podcast around treating the whole person. And I feel like I hope our listeners are hearing so much hope out of this that there is more to investigate. And I feel like my problem for a really long time when I jump off an interview like this would be, I fly to get to you? Like this is out there and I don't know how to get to this. And I'm finally gathering some Ohio resources. But my question to you, because I feel like you've put some program pieces together, can people get to you virtually now? Or tell us about what you offer and how you can help the person going, I don't know where to start.
Okay. Well, what I do is I literally evaluate the whole patient because we're not disconnected. We're not a heart here and a kidney there and some bone over there. We're completely, totally connected. The Bible says the hip bone's connected to the, I like to sing, what can I tell you? Okay. But we are whole beings, and everything is connected. So before I do anything, I do a complete workup. I take a full and complete executive history, everything from soup to nuts, going back to when you had your tonsils out at 2 years old to where you are now. That's the first thing. I then work up everything else because your thyroid can play into this. It could be adrenal related. Your stress, your cortisol, your line could be flatlined as opposed to what the graph is supposed to be. It could be your insulin with pre-diabetes and that type of thing. You could have an autoimmune disorder, which is playing into it. Doesn't have to be lupus, could be anything. There are so many possibilities that what I do is I mean, they usually look and say, oh my God, that's a lot of blood. And I say, yeah, but you'll be fine. It's really not as much as it seems. I look for Lyme, I look for mold, I look for mineral deficiencies, vitamin deficiencies.
Yeah.
I literally look at everything. Now, 9 times out of 10, it's just the hormones. 9 times out of 10. But occasionally I find a red herring. Occasionally I find something somewhere which plays into it. which needs also to be addressed. A pituitary tumor, an adrenal tumor. I mean, occasionally I find something else, an autoimmune disease. Last week, somebody came in and her initial workup came back and she has lupus. So we're going to address that. But you have to look at everything. Now, you can be overwhelmed. One can be overwhelmed. But if you're working with the person, all of that will get worked out. Because again, 9 times out of 10, it's just the hormone. And all we have to do is balance the hormones and we will be fine. Life is about cycles. After puberty, where we as women, everything is related to our menstrual cycle. And after we go through menopause, we need to be balanced. And that's it.
All right. Where is the best place to find you so people can continue to follow all of your amazing wisdom and information?
On the web, I will have them send it to you because I am totally technologically challenged. I've been out of medical school more than 50 years and I'm kicking and screaming. Okay.
Okay.
Literally
We'll put it in the
kicking and
show
screaming.
notes.
We'll put it in the show notes. But I'm on Instagram and I'm on Facebook and or so I'm told because I don't know how to get into it.
We will find you. I
Yeah.
will shout you.
The website has obviously contact information
Yes,
on there.
for everything. Yes.
www.drmarciaharris.com. And there's contact information there if you fill it out. As a matter of fact, tell your listeners, and I can tell them myself, I'm speaking, that if they put toolkit, go in there, fill out the contact form, and just put toolkit. I have what I call the ultimate menopause survival toolkit. How's that?
Fabulous.
The
Fabulous.
ultimate
Yes.
menopause. Just put toolkit in there, and we will get it out to them.
That is fabulous. Yes, it gives everybody a starting spot and to stay connected so they can keep. I feel like people need to keep learning on their own and believing on their own the truth behind all of this to really pull people fully on board. You're amazing. You're wonderful. I like to have my guests kind of, if you were wrapping your arms around our listeners today and could send them off with like, if you heard nothing else, if you hear this one thing out of me, what do you just hope and pray that somebody took away today?
Well, the one thing I hope and pray that someone takes away today is we owe it to ourselves to advocate for ourselves. We owe it to ourselves to advocate for ourselves. No
Simple as that.
one is going to take care of you if you don't take care of you.
Yes. Oh, amen to that. You are wonderful. Thank you so much for joining us. And I hope you come back because I feel like we didn't even touch on things that I
Thank
wanted
you
to
for
jump.
having me. I'll be happy to come back anytime. Or there are 10 other directions we can go with this.
100%. And I need you. So